welcome everybody to the penultimate session in our Empowering Leaders for Safe and Compassionate Care series. We're joined by Tom Bell, who is a member and also director and lead consultant for Cormetis Consulting, as always, delivering this session and all throughout this series. Today is all around ethics for leaders. Tom is going to introduce you to Edward de Bono's 6 thinking hats concept and the 7th orange hat. Tom's got a prop for us today as well, if he pops it on the screen for us all to see. Tom will introduce you how and when to use the orange 7th hat, and we hope you've got lots of questions about this so that you can take it into practice. We are recording today's session. You'll receive a copy of the recording with the slides used and also a certificate of attendance after next week's final session. I'll remind you about that towards the end of today. It is an interactive session, so we'd love to have you unmute, ask lots of questions, see your face. I understand if you can't do that, there's the chat box to participate. And if you have any questions about this session, I'll pop my email in the chat box if you want to send me an email privately about anything. Tom, without further ado, if you'd like to bring up your slides and we'll get going. Thank you all.
Thank you, Jade. Thank you very much. And thank you, everyone, for making time to attend. I do genuinely appreciate everyone who's busy and people making time to come on these. I hope you get something from them. Genuinely, it means a lot to me. Let's go to sharing my screen, and hopefully, he said, we're looking at the right one. That's wonderful. Thank you, Jade. And also, Jade was saying about, repeat offenders who keep coming back, which I'll take as that's a great thing to happen, isn't it? If nobody was coming back, I'd know we were doing something wrong. As Jade said, this is the penultimate. It's the 7th in a series of sort of bite-sized workshops that we designed to build on each other. And I hope that each one of these has provided and will continue to provide a mix of behavioural insights, the interesting stuff, kind of the mind, mind candy, as we call it, practical knowledge and usable takeaways, things that you can actually apply in your workplaces, in your teams and organisations. So the orange hat, why, when and how to use it. I think if there was ever a period in time, kind of a defining era, that needs us to be aware of the ethical dimensions of the decisions that we make and the actions we take, I think it's now. If ever there was a field in which a greater understanding of the practical application of ethics and the need for ethical decision making is required, it's in the field of health and care. I think that if you're involved in the work of providing health and care, and I hope I don't come across as singing to the crowd here, but I think you're involved in something that both transcends and underpins everything else. Nothing else in my book is as important. Now, forgive this shameless plug, but I just wanted to show to anyone on the call who may not know me or who hasn't come across my work, that I mean what I say about the importance of health and care. I do genuinely believe, as Ruskin said, that there is no wealth but life. And I don't imagine any of us on our deathbeds yet are going to say, oh, my greatest desire is for that Italian black marble kitchen top that I saw last week in a glossy magazine. It's not going to happen, is it? We will, however, possibly, I imagine, exchange everything we possessed for a little more time. That's time to breathe, to love, to feel and to experience, So when I say there is no wealth but life, I hope that comes across as I mean it. So, as I said before, it's great when lots of people come, but it's also useful when not so many come because we have a good sized discussion group. So what I'm going to do in a moment is just stop sharing the screen and just get a feel for who's in the room and what people are looking for from this session. If you aren't comfortable speaking, then do feel free to put something in the chat box, And it'd be great to know how many of you are familiar with Edward de Bono's concept of 6 thinking hats, or perhaps just the general work of Edward de Bono himself. So at this point, I'm just going to stop sharing and let's get a feel around the room for who's here and what have we come for. Don't feel obliged to say if you're not comfortable saying it. I'm absolutely fine with that. So I should have stopped sharing my screen, have I, Jade?
You have. I'll keep an eye on the chat box for anybody that can't unmute. So we've got one guest today who is not familiar, and that is Pritpal from North Wales. Thank you, Pritpal.
Okay, thank you for that. That's good. That's useful. At the risk of overstating, and maybe not managing expectations correctly, I would say if you get into the work, some of the work of Edward de Bono, especially the 6 thinking hats, I think it'll change the way you look at things, and it'll certainly change the way that you see how organisations work, and importantly how they can work. Anyone else come for something?
Jodie, are you familiar? Is that a hand for you are familiar, or question?
I was just going to speak rather than put it in the chat. Yes, I am familiar with the 6 hats thinking. I've used it a few times with groups. Sometimes successfully, some not so successfully, but that was probably more down to my facilitation skills at the time, shall we say. But I'm really curious about the 7th hat.
Thank you.
Thank you, Jodie. Jacqueline, is that a familiar or question?
No, I am familiar with it. It's just one of those things that you need to be reminded about. A while back, I did go and purchase the hats from Amazon, really cheap. Sort of, I think it was something about £5 for all the different colours. And we've tried it in various sort of like project meetings or things like that. But it's some things that sometimes you think, oh, that would have been good if I'd only just remembered to to cover off.
You'll have to add an orange 7th hat to that now, won't you, Jacqueline?
But if you can see past the clutter, I'm just going to swing the camera over here, and let's see if we can get this right. So you can sort of see, you'll see in the corner of the loft there, I've got a line underneath that big bookshelf, the hats hanging up, and I've had those for years because I think I come into this loft to work. This is my workspace, and it just kind of reminds me that they're there. And I think you're right. It's one of those things, isn't it? So you hear so much about them, and they're sort of floated around so much you can take them for granted. But yes, I think I got those for about a £5 off Amazon, Jacqueline. So yeah, similar, probably the same reseller, who knows. But thank you for all the comments in the chat as well. That's great. So we've got some not familiar with it, some familiar. I think we're going to get something out of this for everybody. Shall I stop sharing screen and move on, Jade?
Yes, thank you, Tom. It's very mixed audience today.
Okay, no, that's absolutely fine. So we should be back sharing slides, yeah. And okay, so quick recap. Agenda there that you can see. Can organisations possess ethics? I think you'll find that a fascinating conversation. He would say that, wouldn't he? But I think you will. Then we're going to go through a bit about Bono's hats after finding out who killed Bambi, of course. We'll get into the orange hat later on. Empty chair. We'll talk about your gran. Long story, but it'll make sense when we get there. And then we'll finish up with some things you can do that you can think about, and some useful reading, and hopefully plenty of time for discussion and ideas sharing. As with previous meetings, I appreciate people have things to get to, but if anybody is either particularly curious and wants to stay on for a few minutes, I'm absolutely fine with that. I think Jade's absolutely fine with that. And also, if you don't have time but you want to pick up something afterwards, take my email, drop me a line. I'll quickly make time for you. And that, that's not a chargeable thing. I'm not going to say I'm going to charge you for that. I love having conversations with people about these topics because I think there's a lot to be shared. When I submitted the original content to the Institute for this workshop, I missed an opportunity, and that was my mistake entirely. The opportunity I missed was to state more clearly the why of the content of this workshop, because it's easy to talk about something, isn't it, without thinking of the why, because I think we make assumptions, and certainly I fall into that trap of thinking, of course, everyone will understand why this is important. And I realised afterwards that the why is really the most important point. So when I finalised the PowerPoint presentation for the workshop, and as I started to see how important the why was and what I was taking for granted, I realised I really needed to bring the essence of that concept to life for people. So originally we were saying, what, when and how to use, and now we're saying why. And I think that's a really important point. Without further ado, okay, so the quick recap. The Institute and I and Jade put this series together in a coherent sequence. There isn't one of those areas that you're looking at there that you can do or develop as an individual or an organisational competence in and on its own, And one of the things I recall saying to colleagues when I worked in the NHS, and I may have said this to you in previous workshop sessions, is that your external interactions and relationships and perceptions that you form, they are inextricably linked to the quality of your internal interactions, It's difficult to be coherent externally if you're not coherent internally. And if I look up to my left, which I think is me looking to your right, if you're looking at the screens, I have a copy of a safety leaflet that I liberated from a flight. And my excuse is that it was getting tatty and was probably going to be replaced very shortly. Anyway, that's my excuse and I'm sticking with it. But the passenger cabin safety leaflet that I've got up there on my left, it's a constant reminder, just like the hats I have hanging over there, that we are of very little use to anyone else unless we are okay with ourselves. You know, we need our own oxygen masks on before we start to try and rescue or help anyone else. And that's not me saying that any of us should wait until we have all the answers or feel 100% good about ourselves and our own lives before we feel able to help others or attempt to be of value. If you wait for that moment, I'm sure, as you know, you'll be waiting a long, long time. It's merely a reminder that if we and the teams and the organisations we work in, if we want to provide the best services possible, then these have their foundations in and are built upon our own internal coherence. Yeah, order very seldom emerges from chaos, or as one of my favourites, John Ruskin himself, would say, quality is never an accident. It is always the result of intelligent effort. Even when you look around you at nature, and we were talking about ECMs before, again, long story, we'll come back to that. But, you know, nature produces sometimes what might look like perfection out of chaos, but it is actually coming through incredibly intelligent effort. Yeah. So, question: can organisations possess ethics? Without becoming overly philosophical this early in the workshop, this point actually raises the question: what is an organisation? Are people the organisation's greatest asset, as we keep hearing lots of people say, or as I think, its only real asset? The organisation is nothing without its people, is it? You can have a brand, you can have a building, you can have all the apparatus in the world, but it doesn't function without people. Now, no organisation yet has made a decision on its own, as far as I'm aware. People within them have made many decisions on their behalf, and of course that may change with the advent of AI, but as far as we know up to this point, all decision making in organisations is still done by people, by you and I. And no matter how big or small the organisation is, or what sector, public, private or third sector, the organisation operates in, organisations themselves do not make decisions. So, yes, this is a slide that shows you, if you ask Google AI, so I have Gemini AI, one of the benefits of being a student, should organisations have ethics? You know, it will come back and give you that there, and it supplements that answer. By the way, that's stripped straight off the web, but Gemini AI, it will supplement that answer by saying, hey, you know, you should have these things because it's legal compliance, you avoid ethical dilemmas, you protect stakeholders, it gives you competitive advantage. A bit sort of motherhood and apple pie response, really, you know, and it talks about employee satisfaction and improved business outcomes, long-term sustainability, yada, yada, yada. The reality, I think we all know, is that we know that stuff. We know that stuff, but that doesn't stop organisations and the people within them from doing some really poor things because of bad decision making. Yeah. So, who killed Bambi? Well, what animated creature could be cuter, I hear you say? What could be more reassuring, ethically untainted than one of the Disney Corporation's most iconic creations? And who better to bring this joy into all our lives than Walt Disney and his intention to provide wholesome entertainment for all the family? This is, hopefully you can read that slide. When your values are clear to you, making decisions becomes easier. And that's Roy E. Disney. Some of you may have come across this phrase before. It's personally one of my favourites. It speaks to me very clearly. I like it because I can identify with it, and I warm to it because it aligns very much with the notion of principles first, then practice, which I was brought up with, and I guess we're all products of our upbringing. The guy who made this wording famous was, as I say, Roy E. Disney, and he was son of the older brother of Walt Disney, who's confusingly also called Roy, and Roy Jr. served as an executive on the board of the Disney Corporation for many years until his death. Now, there we have it. When your values are clear to you, making decisions becomes easier. That's great, isn't it? In fact, I think that's perhaps where the role of AI could help us all out. But that's, I guess, for discussion later on. So here we are. So this is harking back not that long ago, but, you know, 20 years ago now. Sweatshop. The Nike sweatshop scandal and child labour scandal had come out in the 90s, and lots of other companies had kind of ducked around that, but were still doing dodgy things. So there you've got somebody, probably one of the highest executives and best known people, most influential people, certainly with if you read the history of the Disney Corporation, one of the most influential people in its history, saying that if your values are clear, your decisions become easy. But at the same time, you've got an organisation that's involved in what you can only call pretty grubby reputational issues. So maybe it's just a one-off, yeah? Maybe they learned their lesson. So Bambi's still safe at this point, yeah? Okay. So a few years later, we've now got another issue here. We've got Disney, along with a number of others, accused of child labour. So you've dropped the ball once, pretty publicly, pretty spectacularly. Now we're in this area of being accused again of the same thing a few years later. Right, and then we have this one, don't we? Which is just a few years ago, nightmare conditions where somebody, it's alleged, somebody actually took their own life because of the conditions within the factory. I have to say, by the way, for any of you who have done any research, as I have in my previous lives as a chartered marketer, into the whole role of corporate social responsibility and marketing, some of these things that are going on here, the conditions that people are working in, are horrendous. Now, it's starting to look like a pattern, isn't it? You know, we have a mistake and then another mistake, and then we kind of got this pattern, and it wouldn't surprise us. And here's the problem here: it wouldn't surprise us next year if the same thing comes out again. What it reveals, interestingly, though, is that the pattern does reveal that decision making is influenced and shaped and guided by the presence of strong values and a visible and firmly anchored ethical compass. It's just that the ethics and the compass we thought they were talking about may not be the same as the ones they are applying, yeah? And the various scandals that shook the Disney Corporation and significantly sullied its reputation in the eyes of many stakeholders, these were the result of unethical, amoral decision-making and some glaringly obvious willful blindness on the part of Disney executives. You can see from this that the company's poor practices are still occurring over 2 decades after Nike was infamously first exposed for its issues. As I say, the danger here is that we've now reached a point when the next child labour or cruel employee issue raises its head, we might have stopped becoming surprised. And that's a real danger to us as people, as individuals, as communities, organisations and a society. And the real danger then is that we might simply begin to accept it. We might just say, oh, well, the corporate model is broken, you know. We might just accept on the same hand, health and care system is broken. Therefore, it's okay. We can let those things go. We can be unethical in our decision making. We don't expect people to have to make ethical decisions because we've just got used to it not being the norm. And what's fascinating is those of you who work in the health and care service, and certainly those in the NHS, Wes Streeting's observation early last year when the Labour Party came into power about the NHS being broken. I remember speaking to a couple of chief executives in NHS trusts at that point, and they wanted to remain anonymous. You'll understand why in a moment. But they were saying that their issue is that while they accept that what he's saying is correct, we're now in a situation where the CQC rating of requires improvement has become the new normal. You know, anything else is seen as, well, hey, you know, we must be all right. Isn't that a dangerous spot to be in? It might be the reality, but it's an incredibly dangerous spot to be in. So we have those lovely values on one hand, and we have what we thought were lovely values and family friendliness, but actually behind the scenes we had a lot of things going on which were entirely unethical. I'm going to introduce you now to Bono's hats, some of the things that they are designed to achieve and why I think they work so well. I was going to stop for some questions now, but I might do that a little bit later if that's okay. Just give it a few more minutes, and then, as I say, we'll also have time for questions at the end. So, De Bono. So for those of you that don't know Edward De Bono, a smashing chap. Not every idea of his was, you know, sat comfortably with people, but I guess that's the nature of being the kind of person he was. When I first came across Edward De Bono's writing, you know, so the 6 hats, parallel thinking, 6 frames, 6 value medals, and simplicity, I was immediately engaged. Yeah, here was someone with an incredible intellect who wrote in a very approachable and understandable way. And for those of you that have read his books, as I know some people on this webinar have, I hope you'll agree that the books aren't overly lengthy. The concepts are clear and laid out. And I think he's that unique sort of person whose intellect hadn't separated him from understanding basic human nature. Yeah, he hadn't got so far up that he was no earthly use. I think as well, he got how people think and behave in practice rather than in theory, yeah? And I can't recommend his work enough. The 6 hats, we won't have time to do a full in-depth dive into the 6 hats, and that might be something that the IHSCM considers at some point in the future. But the 6 hats, excuse me, in essence, is a wonderful tool to help decision making and really important thinking. It's thinking that it's designed to help. And it speaks to a very, very real problem. What it then does, I think, remarkably well, is it provides an incredibly useful and effective tool to help the process of decision making. So I think there are few, if any, other books or concepts that highlight a problem so well and then give you the means to address it so effectively. Yeah, we have lots of solutions without problems. We have lots of problems without solutions. What Bono has done very successfully, I think, is pulled together what is a pressing problem and given us a good solution. It might not be a perfect solution, but it's a really good workable solution. I'm just going to talk you briefly through these hats and the idea behind them. So Bono says that if we're conducting meetings or discussions, generally meetings, but it doesn't have to be a full-blown meeting, he says we can use the hats as a means to help us think about topics in a way that we wouldn't normally think of them. And so you can see what he's done. He's given each of those 6 hats there, and you can see he didn't include the orange hat. I'm going to tell you a bit about that soon, but he didn't include the orange hat. He's got these hats here, and what he's saying is every hat is given a label and a purpose. So the black hat, as you can see, it relates to caution. It's used for critical judgment, i.e. it's the negatives. What could go wrong? Have we thought about this could go wrong? Wouldn't that be terrible if? And then, of course, you've got, if you flip that across and you've got the yellow hat, you're looking for the benefits. Yeah, you're sort of looking for the, let's call it the Mary Poppins of meeting thinking, yeah, where nothing's a problem, everything's an opportunity, and da-da-da-da-da. What the hats do is allow people to think underneath that hat for a given period of time, looking at a certain situation, which pulls out ideas. And it means that people can't just defer to type. So if I have a reputation as a yellow thinker, oh, Tom doesn't ever see any problems in anything, then what I've got to do actually is in this setting, I have to use all the hats. And the overview hat that you can see, the blue on there, that's the one that directs. So it's kind of the chair's hat. And this slide here, again, it's not perfect, but it gives a kind of a simple example about how the hats are used. So you would use the designated hat, yeah. You're using that good facilitation that many of you, I'm sure, have. I can't remember who it was who said earlier, actually, that they felt perhaps their facilitation hadn't been up to the mark. You might be being super self-critical there, because I would suggest if you're working in an NHS culture, the culture could be the problem. And again, we're going to come to that slightly later on. But what you do is you say, right, okay, we're in blue hat mode, or in black hat mode, or in green hat mode. And we have to then adopt that, yeah? What we have to do is use questions and thinking that fall under that banner. So we have to, if we are, let's call ourselves a natural black hat person, yeah, for want of a better phrase. If we're a natural black hat person going into a meeting going, bloody hell, I've heard this all before, none of this will work, and da-da-da-da-da, right, okay, Mr. and Mrs. Negative, yeah, fine. Could be based on experience, yeah. A cynic is, after all, just a disappointed optimist. But actually what it does is it says, right, we've got to put that hat aside. We've got to get into the sunshine hat. We've got to get into that part, and we've got to get into the red hat. We've got to get into the green hat. And so we have to do something. And good facilitation, which is super important in any kind of meeting, allows people to push just a little bit and say, okay, we're wearing that hat at the moment. If you've got a negative thought, just pop that aside for now. Hold it for the black hat bit, but just pop that aside for now. Let's talk about the possibilities here. And I think that's a wonderful way of structuring a meeting and making sure that everybody contributes something using all the different hats available, yeah? Now, there are meeting and discussion types in which the value of the hats is amplified, such as when people hold strong views, or a process of maybe groupthink, or a state of summit fever. Anybody who's unfamiliar with what that is, again, make a note, summit fever, get back to me about that. Once those things have begun creeping in, yeah? But the use of the hats, it can really help prompt that sort of, hang on, what might we be missing here? What might we be missing here? And it's that kind of style of reflection, and it encourages some idea and decision making inspection, if you like. So we're thinking about our thinking, and we're inspecting what we're thinking about, and that helps us test the robustness and the validity of our decision makings and our thinking, yeah. the hats, I think, for me, the hats give permission. What they do is they give permission to step into another role, to step outside of what we might be expected to be. So, care home manager, certain expectations there. Clinical director, certain expectations there. Project manager, certain expectations there, which are individually and culturally and organisationally influenced, But it helps us to step outside of those roles. We also begin to see things from others' perspectives, and we begin to understand others' worlds. And I think that's super, super important, because some of you will be tired of hearing me say this, but improvement begins with understanding. If there's one thing I want people to take from every workshop session we've done, it's that mantra that improvement begins with understanding. And again, happy to discuss further what that means either later on or in person. But it also allows us to unchain our thinking from the prevailing organisational cultures. Easier said than done, yes. It helps us circumvent hierarchy, because hierarchy can be incredibly restrictive, particularly in health and care settings. And it also helps us, believe it or not, to have fun and avoid offending, because when we, somebody introduced me to the phrase a while ago, that labelling is disabling. And when we label people as certain types of thinkers or having a certain paradigm or a certain perspective, we disable them, we disenfranchise their ability to contribute something. And we also offend them when we put things on them which aren't appropriate, or which they deem not appropriate. But if within a meeting setting we're all giving each other permission, if you like, to wear a different hat, to share a different view, that becomes something okay. And we can even have a bit of fun with that if we know how to do it. Now, the reason the hats work so well, I think, is that they provide this shared structure for thinking. And forgive me for the facetiousness here, but thinking is an incredibly important activity which we seldom give enough thought to, and there's a great irony in there, isn't there? We need to think about our thinking. Now, for those of you who are thinking that's a bit, you'd be gobsmacked how this can work so simply. And far from actually prolonging, elongating, stretching out, and procrastinating the decision-making process, when you use the hats well, you'll find they shorten it. And the more you use them, the better that process can become. They leave people's egos intact. And what I mean by that is that it allows people to ask questions. If people are under the certain hats at a certain point in a decision-making process or in a meeting, a facilitation, any kind of thinking exercise, if you like, where we have to engage our brains, it allows people to poke holes in things, which I'm a big believer in anyway, because I always think we need to poke holes in theories, because when we poke them, they become stronger if they're good, and they become weaker if they're bad. And I think that's a win-win for everybody. But it leaves people's egos intact. It doesn't come across as personal. If we find something under black hat thinking or red hat thinking, which destroys the sunshine thinker's idea, that's okay, because it's done under the hat. It wasn't personal, And again, I think they foster insight and knowledge in relation to understanding each other's worlds. So not just putting us in other people's shoes and making us think differently, but starting to help us realise why people think that based on the experiences and the perceptions that they have, And again, as I say, if we want to improve anything and make good decisions, then we need to develop our understanding of the environment we're operating in and the issues at hand. Bono, I think, really gets it that we need to get better at our thinking, and for me that was a wonderful thing. So orange hat thinking. This for me is this seventh hat, if you like, is this. I like the idea of having a specific hat to prompt thinking and discussion around the ethical aspects of a decision or a particular scenario. Again, let me get further into this. So why an orange hat? And you might well ask at this point why ethics aren't featured more strongly and explicitly in De Bono's 6 hats. Hang on there a second. We have them here: 6 hats, 6 frames, 6 value medals. Parallel thinking is up on the shelf there, along with many others. You might say, well, why weren't ethics featured more strongly in those? And I actually corresponded with Edward De Bono some years ago, and following his death in 2021, I wrote to offer my condolences, and then corresponded with his son Caspar, who at that point was taking over the reins of De Bono's considerable legacy. Now, Casper's view was that he felt, and to be fair, he was echoing his father's view, that because his father had stressed the importance of values, that this covered, if you will, the area of ethics sufficiently. I disagreed then, and I still disagree, and I expressed my disagreement very diplomatically, very politely, of course. And the reason was, I said, being at the coalface, I'd seen enough vision and value statements. I've worked in the public, private, and third sectors. I've seen enough vision and value statements to pave the M6 and to last me a lifetime, yeah? What I haven't seen enough of is the actual practice of being ethical and behaving ethically, and prompts to do so, yeah, specific references to it. And I think part of the reason for that is that sometimes we can find it offensive to be asked if we're behaving ethically. Of course we're behaving ethically. We wouldn't do anything else, would we? Well, the reality is a little bit different. In my view, the topic of ethics is so incredibly important that I felt ethics warranted and needed a hat of its own. And I actually talked to Casper de Bono about developing a seventh hat concept. And he said, no, we wanted to stick with a sixth. And I can kind of understand that. But I think the seventh hat of ethics is a logical supplement to the six hats that some of you are already familiar with. And as you say, some of you have used. And I chose the colour orange because it was one of my sister's favourite colours. And she used to wear a bright orange cap when the sun shone. But for me, it's such an important topic. Now, I'm going to just let you read that for a second, and then I'm going to stop sharing the slides and talk you through a scenario where hopefully you might want to ask some questions. But I think I read a wonderful book many years ago, which again I recommended to some of you from previous workshops, called Moments of Truth by a guy called Jan Carlson. Now, he wasn't coming from an ethical perspective when he wrote the book, but he makes the point, and I think it's a wonderful point he makes, that once people know, they have a responsibility to act. Now, in his book, he's talking about customer service, and he's talking about remedying problems and dealing with faults. He says, once you know something, you have an obligation to act. And he's the guy that he turned around Scandinavian Airlines from being a really poorly performing airline to being one of the best in the world. But what it does, if you acknowledge there's an ethical dimension to a decision, it makes you start to think. In fact, I think it compels you to try and understand the impact of the decision that you're making. And that means you have to then make time and space to discuss and explore the implications of what you're thinking and look at what might be going on there. So let me just, I'm going to stop sharing the slides. I'm going to talk you through a scenario that occurred with me some years ago. Hopefully still with us. This is good. So I'm fairly new to the NHS. I'm going to take you back a few years now. I think the year is 2012, mid 2012. I just joined the NHS in January 2012. And I was sat in a meeting. It was fairly high power meeting over in a place called West Cumbria. Some of you may know. The area is called Copeland. It has the towns of Workington and Whitehaven and various others in it. And at that point, the trust that I was working for, I was just kind of getting to grips with understanding how the NHS worked. And, we were about to have some budgetary issues. Surprise, surprise. Yeah. The trust had recently become a foundation trust, and it needed to return some good numbers to the regulator, who at that time was called Monitor, and Monitor used to sit alongside the CQC at that point when we had sort of foundation trusts. A conversation went around the room, and it was about how to save money on mental health services in the Copeland, in the West Cumbria area. Now, my excuse for not getting involved, and I have mixed feelings on this, and I'm going to be very candid with you, I have mixed feelings on how I should have acted in that meeting, and how ignorant I was and how I then didn't pick up on that, is that people in the room were talking about how to save money. And the discussion went something like this. We have lots of vacant posts. At that time, there were lots of vacant mental health posts, yeah, in community mental health services and on-site mental health services. And so somebody said, well, if we don't employ to those posts, we'll come in on budget. Okay, that from a business perspective, you could go strictly budgetary. You'd say, that kind of makes sense, doesn't it? If we don't hire the people into the posts, then we won't incur the costs, and we can come in on budget and give the head office what it wants. We can give headquarters the news they want. I look back on that decision, and I look back on the people in that room, and within 2 to 3 years of those decisions being made, that area had the highest suicide rate in England, the longest mental health waiting lists, and then trying to attract people into that service became almost impossible. And so the implications of the decision that were made then were huge. They had an impact on doctors' waiting lists. They had an impact on the community. They had an impact on the third sector. They had an impact on a whole host of stakeholders. Needless to say, the patients and the families and friends of the people who ended up with exacerbated mental health issues and worse. Yeah. And I can't help thinking, if somebody had stuck the orange hat on at that point in time and just said, you know, folks, right, okay, is there an ethical dimension to this decision? Can we talk about the ethics of this? Yes, we know we're a foundation trust. We've got to give good numbers to monitor. We've got to give the head office what it wants, because generally speaking, the messenger got shot if it didn't. But are we making an ethical decision? Are we making a decision here with implications? The answer was yes. But nobody made time to even create the space for us to have that. And I look back on that and I think how different that could have been if we'd used that orange hat thinking in that scenario. I said I was going to make time for some quick questions and thoughts before we get to the end, because I've got just a few more slides to go. While I'm not sharing slides, any thoughts on that? Any thoughts on anything we've talked about so far? Catherine, I can see a hand in the air, yeah. And I can see Victoria's also got a hand in the air.
We have similar conversations all of the time at work. I work in an ICB, and it is clinical policy thresholds that I set. And we have conversations all the time about, why are we not going further? Why are we not putting the threshold at a higher level? And when I say, because there's a risk of clinical harm, that isn't always a good enough answer to keep the threshold at a level that incurs a cost, and it's a real challenge.
I appreciate I've got someone else waiting for a question, but isn't it fascinating that you talk about clinical harm, which most people go, yeah, that's pretty important. yeah, you know, let's not do anything to, because essentially what you're saying is incurring clinical harm is the result of not setting that bar high enough. Yeah, and that's what we're saying, and we're kind of giving that the green light, aren't we? Yeah, it's okay, we can do that. I wonder if phrasing it and labeling it as, you know, as the damage that occurs from the clinical harm, and almost bringing that to life. And again, I'm going to talk a little bit about that later on, because for me, I'm all about the impact, and there are personal reasons for that. But it's that impact, isn't it? It's not just the clinical harm itself. It's what does that then mean for the people that are harmed and their families and friends and loved ones and their lives? Because that's massive, isn't it? But thank you for sharing. I appreciate that. There was someone else with a hand up.
Yes, it's Victoria.
Hello, Victoria.
Hi, Tom. Just with those examples, though, I think is there something about people wanting to wear their orange hat, but the culture not allowing that, or giving opportunities, or indeed the ramifications of that? If you were to say, actually, I believe this impact will be this, and this. And I think that comes down to culture and $50 million question. How do you influence that? And you see this all over. And I was just trying to find it. Actually, there was a news headline about a trust in Wales today that has had some really awful bullying and cultural issues there. But the response was, out of this, I think it was a surgical team, out of the thousands and thousands of operations they've done, there's only been a small instance of harm. So they disassociate. So the culture there clearly is of a blame and non-accountability. So I wonder how you can therefore wear an orange hat under that culture.
It's a great question. I'm going to grab another book if I may. I'm laden with books at the moment. This one is called, oh goodness me, I'll come to it. I'll find it in a moment. Sorry, here we are. Yes, on the floor. Trust. It's a book of really oldie but a goldie, yeah, by Jack R. Gibb. Now he does a really interesting thing in this that you're alluding to there, where you're talking about cultural fit, and he makes the point. And I'm not a huge fan of taxonomies, because I think what they do is they kind of ignore the land mass, and they give you a nice map, but they ignore all the geography and the topography within it. But they're useful. They can be helpful. And the point he makes is that if you find yourself within a culture which is 2 steps above or below where your natural cultural fit is, or where your achieved or desired cultural fit is, then the point you're making is that you simply can't wear that hat. there might not be room for you to wear that hat. It might not be welcome, and it could end up getting you into trouble, which again is something I'll touch on very briefly at the end. But you're right. That is the $50 million question, isn't it? And I always find it fascinating when, and I worked alongside colleagues from PR in the NHS for a number of years, and I always used to find it fascinating that they would use exactly the language you're talking about. They would say, "Oh, we do all this stuff, and only a few people die on our watch." And I wonder if we would buy cars from a car manufacturer that said, the brakes only fail on a small percentage of our cars. We would just shy away from that, wouldn't we? We'd go, not so sure about that. It's not a particularly reassuring message. And I appreciate that's a slightly banal, crass approach to looking at it. But you're right. There's something about, hang on, one is actually too many, isn't it? So can we just, let's have a think about that rather than just going, it's not a big percentage, so we don't worry about it. We don't think about it. We've got other hands in the air. Sorry, who I can't remember. I don't know who came next, so I'm going to leave that with Jade.
We've got Natalia. Good to see you again.
Hello, Natalia.
Oh, you're on mute, Natalia. Just before you get into it.
Thank you for interesting talk. I think I was attending your webinar previously, but it's only now getting understanding coming more clearly, I think, because I don't think I was present. I attended, but I think I was somewhere, my thoughts were away. So what I want to say then, I can see the ethics is something like understanding what is right and what is wrong. And it has to be kind of the way people brought up. It's not just environment and work, it's environment in community at home and how they brought up. And it's kind of in a sense, and it's very difficult. It's very easy to overlook where you're hunting or trying to achieve a quicker goal, but it as a harm is very difficult to rebuild. Because it will come back. It's like a karma. If you've done something wrong because you wanted that, but then outcome will be horrendous, but it come back later. And I think it's also, I can compare it as like plankton biological chain. When there's we think, well, that a little thing is not important. We can just clean it up. But that somebody was using that in a chain, and it was a circle of the important circle, and it was contributing to this, I would say, either environment and the organization, and it was easy to overlook. So I think it shows the sample, and I agree that a heart, orange heart, does exist if it's invisible orange heart, but it is, if we don't pay attention to it, the harm happened, and we probably would never identify what causing it. And I think it would be worse to have in a department. I think independent people who rotate around the different trusts, filling the post in that involuntary service. I don't think they have to employ it, and they have to present in a meeting because they have knowledge of other organizations, and they will easy to spot when that orange heart is missing, and they ask the right question. They shouldn't have any influence, but they would make people to think by asking them questions. And I think that would be kind of keeping us in the loop, because we're all trying to achieve the goals, but we don't think about it's not because we don't think, we're all good human beings, but we in order to achieve something, we dismiss other things. And I've noticed that quite a lot. Yes, I noticed quite a lot, and your presentation just gave me insight and understanding, because I couldn't understand what went wrong, but now I think it helped a lot. Thank you.
Thank you, Natalia. Catherine, you have your hand up. Is that?
Yes, I'll bring Catherine in. Apologies.
It is again. Sorry.
Yeah, it's all right.
I wanted to follow up on what Victoria said, because in a way, it comes from the very top, doesn't it? It's not just about the individual organisation you work in. It's also the overarching culture, the political culture that is dictating the culture to an extent in the organisation where you work. Because the reason that your trust exec or your ICB exec will accept a bit of harm for this decision is the same reason that the government accepted a bit of harm for removing the winter fuel allowance. You can agree with it, you can disagree with it, but it's a calculated risk. We're going to save this money. There is this risk of harm. On balance, do I think it's worth it? Because actually, whilst you talk about it being a safety critical thing like cars and like air flight, that isn't really truly the environment. It might be appropriate to apply to the theatre, to the operating theatre, but that isn't the world that generally health and social care operates in. It's a balance of cost and benefit and risk, and we take the view set by the top that sometimes the pound wins and the person loses.
I think that's a really okay. Yeah, there's a lengthy discussion to be had there. And if I may, my response would be that all the work. So I keep very, very close to a guy called John Seddon, who you might have come across, a very good systems thinking chap. And my experience is predominantly private sector, and actually I found that quality is cheaper than bad quality. And so you're right. The but is, of course, I think the people making the decisions in the ivory tower at the top are maybe slightly detached from that reality, because there is short-term politics and there are electoral cycles and all those other things which we are aware of. Which, by the way, shameless plug here for you, Catherine. You might like this read. I make the point that actually healthcare should be depoliticized. That sounds simplistic, but there are more benefits, I think, to doing that than there are. Just as I think water should be renationalised, but that's definitely another discussion, isn't it? Someone else has a hand up, Natalia. Is it okay, Natalia, if we come to your question when we finish the slides? Would that be okay?
Yes. I just wanted to respond to the previous.
Okay.
It's not about your speech. It's about what just person said. Sorry, I didn't look at the name. It's about balance of cost and benefit, and I want to say that it could be looked in a different way, like Timpson company. The balance is they gave employment to people who coming out of prison, and the balance they're looking, it might be one person who lets the company down because continues stealing from the company, but majority of them became good contributor, and they even work harder because they try to prove they get better, they learn their lessons. So I think the balance could be just taking risk in opposite way, and we have to just adopt different way of thinking, I think.
Thank you. I'm going to start sharing again, if that's okay, and we'll just few slides to go, and I'm actually looking forward now to a good lively discussion. This is great. When and how to use the orange chat. Thankfully, I think we've touched a lot on this in terms of giving you an outline of how the hats, and as I say, we can't possibly cover this in a 1 hour session, which is okay. This is really just an introduction to the orange hats, which I hope you will find useful for those that haven't come across them before. Sorry, the 6 hats. But for me, the orange hat can be used just like the others. It can be used on its own, as a section of a meeting or a discussion, or just like the other hats. I think it can be used between hats also as a method of revealing the ethical dimensions of all those areas of thinking. So, we have an orange hat interlude after each of the other hats are used. Yeah. My take on this is, and my take is personally skewed. It's not politically skewed. It's personally skewed. I believe the orange hat is actually the most important, because I think that's the most impactful of all the hats. Now, I appreciate at this point Edward de Bono may be shouting from his grave, or perhaps not if you're alive to witness what we're going on, what's happening in the era that we are living through. But I genuinely think that in health and care settings, the orange hat should be the primary hat, the go-to hat that's used. And I was having a short conversation with Sue before this webinar, where we're actually saying, wouldn't it be interesting? So, Catherine, you're working in an ICB. Wouldn't it be interesting if every decision was put through an AI orange hat lens for audit trail purposes, so that if things, as they inevitably do, go wrong because people are chasing the pound rather than the patient, we're rolling out the red carpet for the regulator rather than the service user, we can say, actually, why did we do that? What was the impetus for, what was the driving force that made us do that? I think the orange hat is powerful enough to stand on its own, so I don't think you need to use the other 6 hats. If time is short and it's the only lens that you get the chance to look through, then I would suggest the orange hat is, again, Bono may be shouting from his grave at this point, but I think that is the most important hat to use. I actually believe that the ethical considerations should override each of the other areas that he suggests meeting holders and decision makers should be looking at. That is my take on using the orange hat. I think it should be the most extensively used of all the hats. Possible orange hat questions which might help you, and copies of these slides will be available from the Institute after this, so you can have these. And there'll be many other questions, by the way, that you could ask. I think I did a course about questions for the Institute a while ago, where I talk about the power of questions as being really great ways to open doors into having conversations that would generally be seen as perhaps contentious, but a rightly framed question can be a really great way of opening that door. So, ask, is there an ethical dimension to this issue? If we're just talking about changing the photocopier, then that's, there isn't an ethical dimension to that issue, I would argue, or certainly one worth taking into account. If we're talking about services, though, and hiring staff and capacity, things that the health service is there to provide, there's probably an ethical dimension to that. So who might be affected and how? Asking ourselves if we would want those consequences for us or our loved ones. And I think when we personalise it in those ways, I think that, and I've seen so many people, by the way, duck those questions. I've been in meetings with NHS chief executives where that type of question, would I want this for me or my loved one, is ducked because the answer is clearly no, but they can't say that in public. I always find it useful to say, when I look back from the future, will I wish I'd made a different decision? And I appreciate you might say, well, that's impossible to answer, but actually your gut will be telling you whether or not you'd be comfortable with that. Yeah. And that leads on into the next one, which is, would I be comfortable being held to account for this decision in the future? Again, maybe that's where the audit trail, the AI orange hat audit trail could play a role. And lastly, a really simple question, which I use in a lot of my work. Have we considered all the options? Yeah. We talked about quality and benefits and costs trade-offs, but actually we're generally thinking in a particular domain there, aren't we? We're thinking in a particular direction. Have we considered all the other options? I said I would talk about an orange hat, an empty chair, and maybe your gran, and I meant that in the most respectful of ways. There are, I think, for those of you that know about the hats already, there's an opportunity here to combine some methods in your decision making and your meeting sequences. Yeah. So Bono obviously is talking about the hats. I'm talking about an orange hat. The empty chair that you can see in the middle there, that is something that Amazon has made very popular. I think it existed previously, but they've made it very popular. The empty chair is this concept where whenever something's being discussed, we have an empty chair in the room which signifies who it impacts. They talk about the consumer stroke customer. In health and care settings, we'd be talking about service users and patients, friends and family of perhaps. What is the impact of our conversation on that person? And if that person was sat there, what would they make of our conversation? And I think that's a real leveler, isn't it? Would we be comfortable having this conversation if there was a patient or a service user there? Now, you might say that's terribly naive, Tom, to think that they wouldn't think it was because they don't understand the way things work. I would suggest it's our duty to help them understand things work. And if what we're talking about isn't of benefit to them, then perhaps we should be thinking differently about how we talk about it. The granny comes in because Daniel Pink, who, those of you that haven't read some of his books, Daniel Pink has written some great stuff. One of the things that leapt out for me is that he says, when you're thinking of doing a deal with somebody, now he comes very much from the private sector, but he talks about thinking of doing a deal with somebody. When you're thinking of how you treat a customer, how you treat a consumer, think of them as your favourite gran. If you don't have a favourite gran, think of them as your favourite auntie or uncle or whichever you prefer. But combining those hats, chairs, and thoughts about gran, I think can be incredibly powerful ways to start to frame the conversations and the meetings that we have. Yeah, it starts to bring our decisions and our conversations to life by making them human and by talking about the human impacts of them. I promised you some things that you could consider doing, some things to think about, and some further reading. I just decided to go with one thing for this because I sometimes give a list, but I thought, no, let's just do one thing here, manageable chunk. If you feel up to it, if those around you will agree to it, or perhaps you just want to do it on your own, I'd like you to, in confidence, revisit something that went wrong or that you felt went wrong and that had consequences, and look to identify the points where you think orange hat thinking might have made a difference. You might take somebody else's case study. It could be, what happened in Nottingham. It could be, Shrewsbury and Telford hospitals. It could be, Hillsborough inquiry. It could be whatever it might be, or it could be something that unique to your trust or your care organisation. Have a think about where Orange Hat thinking might have made a difference, and have that conversation if you feel able to. Somebody talked earlier about the coaches allowing this kind of thinking, allowing somebody to sort of pick that hat up and go, let's talk about this hat before we go any further, folks. And I completely get that by there. I don't think it's an easy thing to do, and I understand that from the point of view of being in the NHS and having lost my job as a whistleblower because of the things that I try to talk about. Would Orange Hat thinking be enabled in your organisation? Think carefully about that. Yeah, how hierarchical is your team, your department, or your organisation, and do people trust each other enough to share their thoughts? I've seen many a meeting go from being a stale affair where we were all just doing the dance and going through the steps to becoming something quite lively and invigorating and, importantly, useful, because I asked the question, I don't think the people in this room trust each other. It's a great, it's a hell of an icebreaker. I get that, and you need to be careful where you use it. But that's the real thing, isn't it? Do we trust each other to talk about these things? Do we trust each other enough to share our thoughts? Some useful reading, of course. Six Thinking Hats by Bono. That goes without saying. Giving Voice to Values, brilliant book by Mary C. Gentile. The Unknowers, How Strategic Ignorance Rules the World. Fascinating topic. And an oldie but a goldie, Groups That Work and Those That Don't by Hackman. And if you find you like De Bono's work, then you might also like the 6 value medals and the 6 frames. He obviously has a thing about 6, doesn't he? Should have been 7. There you go. But here's a cautionary note. Yeah. And it's a reality. This is a truth. I speak from experience. Yeah. So be careful. Here's a note of optimism. And I thought really long and hard about whether to end the slideshow with a note of caution or the note of optimism. Then I reminded myself about what makes me me, and the choice became obvious. Yeah. So I do what you can, where you can, when you can. You won't win them all, and that's okay. Yeah. But the ones you win may well matter more than you could ever know. Trust me on that. To those that you win them on behalf of. So my sister Alison's death, my life and my family's lives and experiences after the events that occurred, they are case studies in the applicability of the Orange Hat of ethics. The loss we endured and then the struggle we have yet to complete, they are a glaring testament to the absence of structured frameworks to support ethics in decision making and ethical decision making itself. Last month, I came off antidepressants after 7 years. Yeah, my depression was the result of many things, the most significant thing being the loss of my job after whistleblowing. If I could, and I pretty much could, I think, timeline the points over the last 35 years at which I believe if someone had metaphorically placed the Orange Hat of ethics on their decision-making head, things would and could have been so very, very different. And for those of you who aren't familiar with the story of the starfish and that small print there, I won't read it to you now because I'm going to leave more time for discussion, I hope. But I think it's a brilliant message. Thank you for your time. As I say, more than happy to stick around for and hopefully for some discussion. So I will stop sharing now. Again, I was conscious of time there, but so thank you for bearing with me.
Thank you for another impactful session, Tom. It has just gone 3 o'clock. As always, we will stay on 15 minutes towards the end if you have any questions for Tom or I now. Join us next week for the final session in this series. We'll be looking at handling and learning from the PSIR framework, Patient Safety Incident Response Framework, and the impact of that on service users. We hope to see you there. There'll also be a follow-up session after that final series session where we can do some longer Q&A and some practical activities based on what you have learned since attending this series. We'd love to have your feedback as well. I provided my email address earlier on. Love to hear from you. We'd love to see you next week. And if you're leaving us here for today, thank you so much for attending. We'll look forward to seeing you again soon. Thank you. Bye.